Hello, everybody. This is Dr. Langdon, board certified pediatrician, mom of 6, and grandma to 2 with another on the way. Tonight's video is about what some people call flathead syndrome, or what we as pediatricians refer to as positional plagiocephaly, which means a flat-headed area on an infant's head that results from how they are positioned and from spending a lot of time on their back when they're sleeping or in the car seat or in the swing. So let's talk about this. This is a common question, usually at a child's well visit, and we do start paying attention to it early on, particularly if, these are risk factors, if the child is one of twins or triplets or a multiple child, if the child is premature, some people can even call it NICU head, because they're so prone to getting that flat-headedness, that positional plagiocephaly, if they're a preemie. And also infants who have hypotonia or poor tone are more prone to having that flat head in the back. Now, for some babies, they can be born with something called congenital, meaning born with it, torticollis. And so they prefer very strongly from the time they were born to look one way or the other, because that muscle is really, really tight. And those babies may need some physical therapy to stretch that muscle so that they can look midline and not have such a strong preference to look one way or the other. Now, we often will refer to physical therapy for babies who have severe positional plagiocephaly so that the physical therapist can work with that improved range of motion and doing exercises at home. But for most babies who have the relatively common positional plagiocephaly, we just recommend some strategies at home. Now, I want you guys to understand where this all came from. Back in the 1990s, the American Academy of Pediatrics started a campaign. The name of the campaign was Back to Sleep. And this campaign was to help decrease the risk of SIDS, or sudden infant death syndrome. And guess what? It worked. When we do a retrospective analysis, the rates of SIDS decreased by around 50%, we believe in large part due to this public education through the Back to Sleep campaign from the American Academy of Pediatrics. So that's really a success story. The only unintended consequence was that when parents were taught to place their infants on their back to sleep, that's a good thing, prevents crib death, we know it, it's important. It did start resulting in more and more of these cases of positional plagiocephaly. So imagine the baby is sleeping on its back. When it's traveling in the car, and it should be in its car seat properly, that's pressure on the back of the baby's head. If it's in its swing, that's pressure on the back of the baby's head. And the brain's rapidly growing, so it's pushing the skull out as the brain grows. And if there's pressure, it doesn't grow as much in that spot. So the treatment for this is to get the baby off its back as much as possible, still with following safe sleep guidelines. So we would recommend tummy time throughout the day, as much as the baby can take it, as much as you can supervise, because we don't want it left unattended or sleeping on its tummy, of course. We recommend avoiding swings and car seats. We recommend holding the baby upright when you can in your arms. I can tell you many of our fussiest babies, of our very own babies, were the most beautifully round-headed ones, because they were not going to be found spending hours and hours in a row in the crib on their back, because they would have to be nursed every 2 hours as even older infants sometimes. But it did keep with a very beautiful head shape, at least. And as the baby grows and spends more time upright, either in your arms or because they can sit independently by 6 months, then the skull has time to sort of catch up and remodel and round out and fill in and those things. Also, at some point, with a lot of hair growth, it's going to cover up some of those deformities. So here's a question a lot of parents ask: is my baby's head flat enough to need a helmet, or that's sort of an orthotic device to put pressure on the places that are already big and no pressure on the places that need to grow out to fill in so it'll be a more rounded head? Well, there are a couple of things that we look at. So my best advice to parents is, if you are worried about this, that your child may need a helmet for this positional plagiocephaly, please see your pediatrician. What we don't want the child to have is something called craniosynostosis. Now, a baby's skull has 4 sutures, or sort of edges of bones. And if those sutures, they're split on purpose so that as the brain grows rapidly, the skull can grow as well. But if those suture lines prematurely fuse, then the head grows in all sort of odd shapes. Like, for example, there's a metopic suture here midline, and if that prematurely fuses, the baby has sort of like a brow, this ridge, and their head sort of triangle shape. That's a problem. So actual craniosynostosis is a much bigger problem, requires a referral to neurosurgery and potentially often surgery. And then they're fine. It doesn't have long-term effects if it's dealt with. Now, that's a whole different thing than what we're talking about. This positional plagiocephaly, or the flattening from positioning, that's more likely in preemie babies, hypotonic babies, or multiples, that doesn't have anything to do with brain growth problems, developmental problems, neurological problems, seizure problems, none of that. This is a cosmetic issue. So when I tell you the most important first step is see your pediatrician, it should be board certified. It should be somebody with experience looking at babies, as we all are in pediatrics. And what we're looking for, do they have severe facial deformities? Is the head so asymmetric that one ear is pushed farther, that one eye is more prominent than the other eye? So if they have asymmetric facial features, that would be a concern, not even for craniosynostosis, but that it's a pretty severe plagiocephaly and probably would qualify for a helmet. Now, we would recognize craniosynostosis and we'll refer that immediately to neurosurgery. So if your pediatrician who's been practicing for years, is board certified and experienced, looks at your baby and says, it's a little flat, but I'm not worried. I don't think it would be worth the aggravation of a helmet. The baby would have to wear 23 out of 24 hours, very sweaty in there. For some insurance types, you even have to be cleared by neurosurgery to even get the helmet, and they are pricey when insurance doesn't pay for them, which they often don't because it's honestly just cosmetic. It doesn't have to do with developmental outcomes or IQ or any of that stuff or cognitive development. So I would say see your pediatrician, and if they say you're okay, you're probably okay. Now, if it's a very young baby and it is really hard to get that head to turn, we're probably going to refer you to physical therapy for concerns of torticollis. But in the older babies, we're just going to remind you, do all the things you can to keep the pressure off from the very same spot. So many babies have a preference from, not a severe preference from side to side with torticollis, but just a little bit of a preference, maybe from how they were positioned in utero. So when they first come out and they want to look this way, the longer they look that way and the flatter it gets on that side on the back, the harder it is for them to look any other way because their head just settles into that one spot. So several things can cause this or perpetuate it. It's usually caused by in utero positioning. But if you find yourself placing the baby in the crib in the exact same way every night, imagine that. You're holding the baby, and you place them down on their back in the very same way with their head at the same end of the crib. Maybe their head's in your left hand, so you place them down. Then they're going to have to look to their right to see out of the crib towards the room where everything fun is happening. And that's what they're going to want to do. So I tell parents to place the infant in different areas of the crib, or if you have a mobile that's visually stimulating, place it where they have to turn the way they don't want to turn to see it to get that visual reward. So they practice moving their head around, and that helps round it out on the back. So when you get that cute little area of baldness in a line from them going like this, just be grateful for it because that's preserving their cute little rounded head, which is a good thing. So be aware to place your baby in different positions in the crib. Give interesting visual cues in different places so they have to move their head to look around. Make them do tummy time, even if they hate it, because that gets the pressure off the back of their head. And then see your pediatrician if you have additional questions. We can always do a referral if we're not sure. I can tell you we're cautious, though, because of all these recommendations of not referring unless it's severe, because of the cost and just it's unnecessary and it's inconvenient for the family. But the other reason we all feel like, I think everyone was taught in medical school that with some specialists, if you have a hammer, everything looks like a nail. So if you professionally place helmets on babies, you probably feel like every baby in the world needs one. So we try to be cautious about not doing over referrals because with time, even moderate cases of positional plagiocephaly sort of take care of themselves. So I hope that answered all your questions about positional plagiocephaly. Feel free to let me know if you have additional video ideas or questions. Hope that helped. Thanks.